This video has been made for patients who have been referred to the ENT and Facial Plastics Department for surgical management of skin cancer and other skin-related diseases. Your journey will begin in the outpatient clinic. Here, doctors or specialist nurses from the dermatology or ENT department will examine your skin lesions and decide if these need removal. If surgery is recommended, you will be referred to the ENT and Facial Plastics Department. In order to streamline the pathway to your procedure, an electronic referral to ENT will be made and you will be added directly to the waiting list. To assist the team in planning your surgery, a photograph may also be taken. When a date for your procedure is found, you will be contacted via phone or letter and given instructions of what to do before your procedure. To reduce excess bleeding, we generally recommend patients stop any anticoagulant medication before their procedure if it is safe to do so. If you have not received instructions relating to this, please contact the department. We also ask patients to stop any herbal or complementary medications that may thin the blood. These are listed here. On the day of the procedure, you will be asked to attend the Diagnostic and Treatment Centre, or DTC, at Basingstoke Hospital. Expect the process to last somewhere between 2 to 3 hours. You should arrange for someone to drop you off and collect you after the procedure. Here, you will be met by the admitting nurse, followed by your surgeon, who will discuss the procedure with you and answer any questions that you may have. Your surgeon will also ask you to sign a consent form if this has not already been done. You will then need to sit in the waiting room until your procedure slot. When it's time for your procedure, a theatre nurse will take you to the operating theatre. Here you will be placed on the operating table. Your surgeon and assisting nurse will then mark out the lesion that needs removal, followed by applying the local anaesthetic. This part can be uncomfortable, but we try our best to minimise any pain as much as possible, and most patients tolerate this very well. Next, the skin is cleaned with a special cleaning solution and drapes are placed to keep the area clean. The procedure itself will last between 30 minutes to 1.5 hours, depending on the size and location of the lesion. Once the lesion is removed, this will be sent to the lab for analysis. This is to confirm the diagnosis and to make sure all of the lesion has been removed. The defect left by the surgeon is then reconstructed depending on the location and size. This can involve simple sutures, a flap of normal skin near the defect, or a skin graft taken from your thigh or neck. Once the surgery is complete, you will wait in the recovery area and then the discharge lounge. Here you will be offered light refreshments. When your nursing staff are happy that you are safe to go home, you will be discharged. You will be given a discharge letter alongside an antibiotic ointment that you will need to apply to the wound twice a day until the sutures are removed. You should expect the whole process to last between 2 to 3 hours. Approximately 3 weeks after your procedure, you will be called by the ENT doctors with the results of the lab analysis. If appropriate, the Skin Cancer Multidisciplinary Meeting will also review the results. In the rare event that further surgery is needed, you will be informed during the phone call and placed on the waiting list for revision surgery. The North Hampshire ENT department provides a fast, efficient and patient-friendly service with very high patient satisfaction. Over 94% of skin cancers are removed completely on the first procedure, with few requiring revision surgery. If you have any other questions about our service, please email us on entsecretarypnh@hhft.nhs.uk.